Okay friends, so in this video we will going to talk about the diagnosis of influenza virus infection. Okay, so the diagnosis is first done on the basis of the patient's medical history, patient's physical assessment, and then by knowing if there is an influenza virus outbreak in the community around the time of symptom onset. Okay, now by looking on the symptoms, doctor will first try to predict what kind of virus or bacterial infection it could be, and then they can perform also diagnostic tests that will find out the presence of that bacteria or viruses. Okay, for influenza there are three standard diagnostic tests available. One is RT-PCR, that is our reverse transcriptase PCR, that can detect the viral RNA. It has a good specificity and sensitivity. It can differentiate between influenza A and B. So here what is done, that in RT-PCR from the sample we are isolating the RNA and then we are trying to convert them into cDNA. Okay, now a PCR process is performed on this cDNA where the probes are specifically complementary of the those cDNA that will ultimately give you the viral RNA. Okay, understood what is going on here? That means, remember, after taking the sample, suppose you have collected the blood sample, that blood sample will contain the RNA content of the patient, also it will contain the RNA content of the virus. Okay, and what is your job? To isolate the viral RNA, right? So what you will do, you will perform reverse transcription of all the RNA into cDNA. Okay, and RNA means obviously there will be mRNAs. Okay, now you will perform PCR. Okay, and the probes that you will use here, because you know that in PCR there are two probes required. One is forward primer and reverse primer. So here the primer that you will use, not the probe, they are primers, because probes are just radioactive elements, but here we will use primers. Okay, so sorry for the probe, it will be primer. Okay, so now this primer will be especially specific or complementary. Okay, this primer will be very specific, and these primers are nothing but complementary sequences of the cDNA molecules which is coming from the viral RNA. Okay, because yes, the genome of the influenza is fully sequenced, so we know their genomic content, and from that it is very easy to construct a complementary primer, isn't it? And then if you find out that yes, your PCR is being amplified, you have to perform a real-time PCR technique, then you can ensure by looking at the CT value that yes, your patient may be infected. Now rapid molecular assay can detect viral RNA. It is similar like RT-PCR. It will also provide you a good specificity and sensitivity and can differentiate between influenza A and B. But the most common test that we are using is the rapid influenza diagnostic test. Okay, it detects viral antigen. Some of them can differentiate between influenza A and B. This test is less sensitive and specific, but we are using it because it can give you result within some days or hours. Okay, they will provide you a faster result. That is why this test is commonly used in diagnostic labs for diagnosis of influenza. Okay, so that is the reason. In Because if a person is infected with influenza, it is necessary to start their treatment as soon as possible. That is why for getting the result fast, we are using rapid influenza diagnostic test. Then later we will also perform RT-PCR and rapid molecular assay for assurance. Okay, so this video we are ending here. So thank you for listening to this class.